Cultural risk. In this model, we will learn about the concept of cultural risk. We will start by studying a real-life case called My Experience in the Hospital. Then, we will review some definitions of cultural risk, as well as some implications for clinical practice and beyond. Finally, you will have to take a quiz to move on to the second model. Let's take a look at the case. This story from an indigenous woman in Guatemala illustrates a fundamental problem in many countries. The government usually supports health services firmly based on the Western biomedical model. In contrast, in developing countries, up to 80% of the population seek care in traditional health systems, creating a care gap between the community expectations and needs and the physician's knowledge and skills. This care gap is where cultural risk happens. Cultural risk or cultural unsafe practices occur when a health professional is not aware of the cultural needs of their client and rather tries to impose their way of thinking. Cooney defined cultural risk as any actions that diminish, demean, or disempower the cultural identity and well-being of an individual. Please take a moment to reflect on this definition and revisit our case study. Are there any cultural unsafe practices happening in the case? Could you provide some examples? Let's talk about the consequences of cultural risk in healthcare. As was depicted in the case, it is not uncommon to hear rural indigenous women saying that they would rather die at home than go to a hospital again. Cultural risk often leads to confrontation, discrimination, and harm towards the patient, thus hindering the access, acceptance, and effectiveness of healthcare, and leading to disparities in healthcare. Furthermore, limited access to Western care may be just one side of the story. As was explained by Bernal in 2005, health disparities might also be explained by cultural preferences for traditional practices. We will return to this later, but please bear it in mind for now. Please take a couple of minutes to complete the quiz, and then there are some supplementary material to review if you want to deepen your knowledge on this topic.